Okay, Dalia.
Mm-hmm.
So a baby brought in by mum with bruises and retinal hemorrhages. Okay, and the peds registrar is not on site until tomorrow, and obviously you want to admit the child overnight for observation. You want to keep them for observation, and obviously you're not doing anything for the baby. You're not treating them at all. But then mum is not happy, and she thinks it's a waste of time, and she wants to go home and take the baby home with her. So your duty is to discuss with the mother the situation, and then just address her concerns. And again, she's not happy. She's angry. She's been there the whole day, and she thinks that you do nothing for her and or her baby.
Okay.
So in the exam, they give you some time again to write a couple of notes. It might be useful. It might not. It's up to you. You want to start, or what do you think? You ready to go?
Yeah, I guess that's fine.
Fine.
Services.
So I think you've got like maybe 5 minutes in the exam.
Yeah.
In my experience, I spent those 5 minutes writing stuff, and then I did not look in the thing a single time. So especially if it's an angry patient, sometimes they stress you out.
Yeah. Okay. So good afternoon, because my exam is going to be at 3 p.m. So good afternoon. I'm Dr. Delia, one of the eye doctors. Can I please confirm your name and date of birth of the child? Sorry.
Yes. So it's Alex. He's 6 months old.
Okay. I can see you're pretty upset, and I'd be upset if I were you as well. Can you please tell me what your understanding of his condition is so far?
I don't know. I mean, you tell me. I mean, you're the doctor, aren't you? So you tell me. I don't know. I've been here for hours, and no one's telling me anything.
Mm-hmm. Yeah, I understand. If I were you, I'd be upset as well if I'm here for hours and hours and nothing seems to be happening. So I feel that I must explain to you what is happening actually. So the injuries that your child has, they are suspicious of non-accidental injury, and we take these cases very seriously.
What do you mean non-accidental injury? What does that mean?
We think that it could be not an accident that caused him these injuries. So it's very important, I'm sure, for you as well, to make sure that your son is doing very fine, and to exclude that there could be any other causes that could be harming the child.
So you think I've harmed my child?
I'm not sure, but we must make sure that the child is safe, and I'm sure this is something you would want to make sure of as well.
Yes.
So the usual protocol in these situations is that we have a pediatrician who is responsible for such cases. The pediatrician is not on site until tomorrow. And in these cases, we have to admit the child with the one who presented with him, who is yourself. And then the next morning, when the pediatrician is here, they would look at the child, make sure that that the child doesn't need to be referred for social services, just for the safety of the child. This is something just to make sure that the child is doing fine.
So you're saying, so I'm really not happy with this. So I've been here for hours, and at the end of the day, you're telling me that I've hurt my child, and now I can't go home? I can't go home now?
Okay, so if I were, I'd be very upset. I understand that. But let's just make sure we are on the same page. So we're not saying that you hurt your child. We're not saying that at all. We're saying that there could be something that hurt the child, and we must exclude that. And we need you to help us with that. I'm sure that you care about Alex and making sure that he's doing fine.
Yes, I do, definitely. He's my child.
And that's great. Can you please tell me if anyone else witnessed what happened, or was there anyone else with you then?
No, I mean, he fell on the floor. I was trying to bathe him, and then he fell on the floor. Oh, an accident, obviously. And then I just wanted to make sure that he's okay.
Yeah, if I were you, I'd come to the hospital right away. So you did the right thing. Do you have any other kids?
I've got 6 kids.
Okay, and who looks after Alex and the others?
I'm my own now. I'm divorced, and their father usually comes every now and then, but I'm on my own. I take care of them myself.
So when that happened, you were on your own as well? Yeah.
Yes.
It must be very challenging, having 6 kids and Yeah,
Yes.
it must be very challenging.
It happened
So
before,
again,
actually. It happened a few times before, unfortunately, but I didn't think much of it. But this time he fell on his head. That's why I came in.
it happened before that he fell while taking a bath, or
Yes, so it happened once
okay.
in the bedroom, and then before
Okay.
it happened in the bath before, but he didn't fall on his head, so I thought it was fine. But this time
Okay.
he fell on his head, so I was concerned.
Okay. So can you tell me before? So like, what were the time intervals between each incident, for example?
I can't remember. A couple of months, I can't remember.
Okay. And he felt today, and that's why you came today, right?
Yes.
Okay, okay. So again, we're not saying that you hurt your child. I mean, it must be very challenging to take care of six children at the same time. We're just saying that anything else could have hurt him, and it's the usual protocol and the duty in such cases that we take these things very seriously and make sure that no one is being hurt.
I'm still not happy. I want to take my baby now. I want to go home. I'm not happy now.
Okay, again, I completely understand that, and I'm sure you have other things to tend for. Um, I will not prevent you if you insist on leaving. However, you must know that if you do leave, the police will be informed, and then they can file a report for you to have to stay in the hospital. And I really don't want that to happen.
What? So you are you kind of taking me as hostage or something? I can't leave?
We do take these things very seriously. Again, it's our duty to do this by law. I do not want to call the police, of course, but I want you to help us make sure Alex is fine by staying here for the night so the pediatrician can see him the next day.
So what if I want to go home, get some stuff, and come back? Can I do that?
I don't, you mean by leaving Alex and going on your own?
I mean, ideally, I'd like to take him with me, obviously.
I don't think this would be possible. I'm very sorry, but you can, if you can, maybe I can help you call someone to get you the things that you're missing. Is there anything I can do to help you?
Can I go home myself on my own and get some stuff and come back?
I'm not sure. I'd have to call my consultant and make sure whether this is possible or not.
Okay.
Do you have
fine.
any questions? Are you following with me? Do you have any
Yeah,
concerns?
I'm just not happy. I think I'm going to make a very big complaint. What's your name again?
I'm Dr. Dalia Habib.
And is there anyone senior I can talk to?
Yes, of course. I can call my consultant and see if they can arrange to meet with you or at least call you on the phone if they're not available physically here now. Is there any other way I can help you?
No.
Make you feel better about this? Or
I just want to go home anytime soon. So just do whatever you want to do, and then I'll see what happens. I'll just have to wait with Alex overnight.
Okay, so just to summarize what we talked about is that our primary concern, me and yourself, is Alex. And I'm going to call my consultant and make sure he has a phone call with you to address any further concerns that you might have. I'm sure we both aim for the best for Alex.
And let's say, so what happens tomorrow? I mean, let's say the pediatrician genius will come in and check Alex. Let's say if they're fine. Let's say if Alex is okay, otherwise, can I go home then?
Well, that of course has to rely on what they say. That wouldn't be my area to comment on. But if they do suspect that this was a non-accidental injury, then they might call in the social services, and they have their own protocols as well, which at the end all aim to make Alex safer. It's all for the best.
Okay, that's fine. Tamam?
Thank
Okay.
you, Dr. Mustafa.
Um,
So, like, I'm not very familiar with what happens next after they call in the social services. So do I need to know something about this?
yeah. So again, it's not your it's not our duty to chase it up with social services. So we've done our job to diagnose there is a concern and refer them on to PEDS or to social services. Yeah, and there's always a lead on safeguarding in your unit and in the hospital. So usually in your unit is a pediatric consultant. Yeah, or usually it's lead optometrist or orthoptist, sorry. A chaperone is a very good idea as well. Adham was saying that you wouldn't come up with the term NAI. I agree with him. I agree with him because you just confront the patient and it just doesn't end up well. I think it's debatable, but I wouldn't say non-accidental injury. You can just say that because he's very simple. So he had a fall. We just want to make sure that he's otherwise okay. You know, you do not mention that there is bruising. You do not mention that we actually found hemorrhages at the back of the eye. You might not disclose any of that. It doesn't change anything in the management. But you've got an excuse that there is a history of repeated falls, and we need to escalate it to the pediatric team to investigate more and make sure that Alex is okay and that he's not going to be safe if he goes home. If he's otherwise unwell or something, then we need to keep him in the hospital for observation, and that's local protocols. Maybe you might mention that it's local protocols, it's local guidance, those sort of things. But I agree with Adam that if you say non-accidental injury, they go like, "What do you mean? Did I hurt my baby? Are you saying that I'm crazy? Do you say I've hurt my baby?" That sort of thing. Especially if they sometimes mention a history of violence at home, domestic abuse with their father or their sort of father-in-law or something. If there's any history of any issues at home, any other child in the family is looked after. Yeah, so as she's done, she asked about the situation at home. Yeah. So again, I wouldn't spend too much time investigating because it's not your main duty in this sort of exam scenario. Your main target is to calm her down and to explain the situation as much as possible. All of what you're doing, the peds will do it and the social service will do. So I don't think you need to spend too much time in that station, examining and investigating the situation at home. I think the main thing is to explain to her that it's for his safety and that's local guidance, and that you need to flag it up, and then she's not allowed to go home with her child. If she wants to go home, she's allowed to do that. Okay, so she can go home. She can actually might not come back if she's kind of she's afraid of something. She might go home, and then that's the police to investigate. It's not your issue. Yeah. But at that point, I would inform the police. Yeah. So that she went home because actually, if there's a history of problems at home, she might injure her other children. Yeah. Or the father-in-law. If there's any sort of a history of domestic abuse or drug abuse or anything like that, you need to make sure that the other babies at home are okay as well. Yeah. So you need to think a bit wider. The picture. Yeah, so there's a few terms that you need to say. You need to say that you will escalate it. You will need to say that there's a local safeguarding person or officer that you need to flag it up to. Yes, she can definitely leave. Yeah, so you cannot force her to stay in the hospital. She can go, but without her child. Yeah, but as I said, if there are other children at home who are you think are at risk of issues, then you need to involve the police. Yeah, because the same might happen to the other children. Who knows? So that would be the sort of escalation of things. And then the other scenario might be actually that this mother is very angry. She actually, stands up from the chair and is actually going ahead and taking the child and going outside the door. So at that point, you need to inform not the police, you inform security first, yeah, and then tell her that I'm really sorry, but you can't leave. I'll inform security now, something like that. And obviously, the security, if there's any issues, they will involve the police as well. So that's how to escalate things. That's the worst scenario. I don't think that will happen in the exam, but if it does happen, and she actually takes the baby and walks out the door, then you need to force her, and she cannot leave with the baby. Okay. Yeah, so at that point, security will call. So you wouldn't call police straight away if she's walking out. You'd call, because police will take some time to come in. So it will be security. So you need to involve security straight away, and they will force her not to leave the hospital. and then at that point just gives you more time to escalate it even more if necessary. But then at that point it will be a security sort of issue or whatever. Anyone can call the police. It's not an issue.
I'm just kind of I don't know how to bring this, but like we should tell the parents that we're considering social services. So how can I say that without mentioning that it could be an accidental injury? So how can I bridge that gap?
So I'm not sure. Would you bring up social services? I'm not sure. I mean, I haven't read the.
It's page 231 in communication.
Does it say that you need to involve the social service to mention to the mother?
They mention safeguarding, and they mention that they suspect it's in an accidental manner, and that's hospital protocol to be admitted for the next day for the pediatrician to see him. And then
but not social services.
They mentioned safeguarding somewhere.
Yeah, so safeguarding is different than social services.
Yeah.
So safeguarding is a local protocol or local guidance to involve the consultant lead or the orthoptist lead or whatever, just to start the process. And then if it's necessary clinically, and it's indicated clinically, then we would escalate it. So social services is like the sort of the
after step.
Yeah, so the last sort of resort or something if it's really confirmed. So you wouldn't inform social services to start with. Yeah. Consultant discuss that those social services at this point. Yeah. But again, there are hemorrhages at the back of the eye. That's actually what brought up the whole thing. Yeah. So I think there is evidence of NAI. Yeah. And that's why you need to keep the baby. That's why you're keeping the baby, actually. Because the history might not be like that at all. She mentioned that she dropped the baby. It might be something else. Who knows? But the other thing that I wanted to mention is that the standard thing in the UK is that actually this baby needs to be examined by a consultant within 24 hours. Yeah, a consultant has to be a consultant, not a registrar, not a trainee, not a fellow. Ideally, a PEDS consultant as well, within 24 hours. Yeah, a PEDS ophthalmology consultant. Okay, and again, there is a specific form. I think it's on the college website. You download, you fill the findings, and then has the thing stopped recording for some reason? Is it still recording? Do you guys know?
Recording.
Still recording, yeah?
Yeah.
Okay.
Sorry, I think I just asked the question in the wrong way. What I'm trying to say is they mention in the book they should be very honest about what's going on with the parents. So how can I be honest but not mention non-accidental injury?
I mean, you're still honest. You've got concerns, but your main aim is to keep the child in the hospital without confronting the mother. It's tricky. It's not easy. But I think, in the exam scenario, it depends on how the mother will react. If she keeps asking you, so it depends where she wants to guide you towards a discussion. I think if the what was I going to say? Yeah, if the mother keeps asking you why you're keeping the child in, then you might say that I found some bleeding at the back of the eye. That might be an escape route to say, we need to keep an eye on these hemorrhages at the back of the eye, although we're not treating them, but we need to keep an eye on them. And that because of the local protocol, we need to refer them to pediatricians to make sure that they're otherwise okay. If she's an annoying mother, as I said, she might confront you and then, get angry and then take the baby and walk out the door. I'm just trying to, imagine and assume different scenarios. Yes, so it's not the ophthalmologist's job, but the issue is that the PEDS is not around. That's the trick in this sort of scenario. Yes, so you're escalating it to the safeguarding anyway, definitely. But you need the consultant to look at the baby, basically. You need the PEDS consultant ideally, or the ophthalmology consultant to look at them as soon as possible within 24 hours. That's the protocol. Yeah, you can examine the baby, but again, it's also lots of responsibility because if that mother goes to jail and goes to court, they will look at the notes, and then it has to be someone senior enough to examine the back of the eye of a baby. So ideally, it should be a pediatric consultant. What else I wanted to say? I had actually just had yesterday from yesterday on call. I had an NAI. Again, family, 6 children, drug abuse, domestic abuse, and I think the baby, according to the mother, kind of went blue and floppy in their pot all of a sudden, and that's after feeding or something, and that's been like that for like 15 minutes. So the history is actually the baby had a cardiac arrest at home after the hospital, and then they came into the hospital, and it's a very poor prognosis child, and they called me to go and examine the baby. I'm happy to go examine the baby, but again, legally, it needs to be the consultant. So definitely, the first thing you need to do is involve the consultant. Definitely involve the consultant. You do not want to take responsibility, and then they should be able to see them within an hour, or discuss it with their pediatric consultant colleagues, and they come and review the baby if they can within 24 hours. Yeah, I don't think it's ED consultant. It has to be the pediatrician. It has to be the pediatricians that examine the baby, and they're very experienced in dealing with those sort of things. Yeah, my child was a very poor prognosis, and the registrar was like, they're not going to make it anyway, but for legal reasons, we need to document. It's not going to change anything, obviously, but it's all for medical legal purposes. I like how you sort of try to, again, examine and investigate what are her concerns, try to explain the situation. You offered her help at the end. You asked her. You always ask them. Yeah, is there anything else you need? Is there any other questions that you've got? You always sort of give them a chance to talk. But those are the most tricky. Again, obviously, I'm trying to simulate things, but just always assume the worst in the exam. She might shout at you. She might sort of, be angry. She will try to stress you out. Maybe needs to say I want to have some blood tests. It's debatable. It's debatable. I'm not sure. I don't think there is anything right or wrong on these things. It depends on the scenario. It depends on the examiner. It depends on the patient. So, as I've said before, the patient has got an influence on the marks, and the examiners ask them, "How did that go? What do you think? How did Dalia? Did you feel okay with Dalia? I mean, did she miss anything? What do you feel?" And they've got influence. So I think it depends on how well you sort of discuss it, how well you sort it out on the exam. So there's no right or wrong, as long as you don't say anything sort of like a red flag. So let's say if you allow the mom to go home with her child, that's done. That's you lost the station. Yeah. So some red flags you cannot do or say, but otherwise those sort of debatable points are okay-ish. It's not a conclusion of NAI, it's a suspicion of NAI. Yeah. So the history might be consistent, and it might actually cause retinal hemorrhages. But if there is any slight suspicion, you need to be careful. You need to protect the baby unless, until proven otherwise, basically. So they need a formal assessment. They need to flag things. And then the pediatricians are as I said, they're very experienced in taking more history. If they think they need to involve social services at that point, they do. So it's not. So our job ends at the point. We do not get involved after that. Yeah, just basically examining the back of the eye, and that's it. Fine. Well done. I think you pass. I mean, you've done well. You don't need to sort of ace the station, but I think you've done well.
Thanks.